Hi viewers, this is Dr. Vinay. Okay, I have the 4 years experience in medical coding and the 8 years experience teaching field. Okay, I'll introduce the one beneficial course of yours. Okay, and before going to that, I'll explain a small thing. And in the human being, okay, everyone they look for two things. One is job, one is marriage. And before the marriage, everyone look for good job. What type of job you're looking for is, okay, one is secure job, right? And one more is no tension, no bother, no worry job. Okay, clear? And one more is 6-digit salary, right? Okay, clear? Everything is there in our medical coding. Okay, clear? Right, coming to the point here, and our medical coding course. Okay, clear? So no tension, no bother, no worry job. And one more, that more salaries are more than 10,000 salaries. Okay, all MNC companies, they're providing the cab and food facilities to you, and daily 8 hours and weekly 5 days. This is our job benefits. Okay, clear? So let's we go with the what is medical coding role in our medical coding. Let's we go with that. Okay, clear? Okay, let's we go with what is medical coding and everything. Okay, so let's we go with, listen here. Medical coding is a process. It is a process where convert the diagnosis and procedures into universal numerical coding system, that is medical coding. Okay, clear? Here diagnosis means diseases and procedure means surgeries. Simple job, thoroughly observe the case sheet, identify the managed diseases, managed injuries and managed surgeries, and we are converted into universal numerical coding system, that is medical coding. Okay, clear? It's a very simple job, right? Let's we go with one sample. Okay, for example, a patient suffering from fever. Okay, imagine this is the fever patient. This fever patient entered into the hospital and the first meet with the what is that receptionist and pay the consultation fees, that is 200 to 600 rupees. And after that, he meet with doctor and the physician examine the patient and advise the what is that investigation. And before going to the investigation, again he pay, that is 200 to 10,000 rupees. For example, MRI, 2D code, TMT, CT scan, everything. After getting the results of investigation and doctor prescribe what is that prescription. What is the mention the prescription? Patient name, age, sex and MR number and hospital details and doctor details and patient details and everything, and followed by what is that complication. Finally concluded whether suffering from the fever, okay, or not and everything, and he prescribed the some medicines, right? After getting the results of investigation and the doctor prescribed what is that prescription. What is mentioned the prescription? Patient name, age, sex and MR number and hospital details, and everything is documented and followed by what is that complications. Okay, finally concluded whether the patient suffering from malaria fever, typhoid fever, any other fever, and prescribe the medicine. The patient take the medicine even to the home, right? Okay, coming to the US, UK, Canadian and Australian. These are the well-developed countries. In these countries, each and every person have an insurance, right? Okay, even birth baby also have an insurance. For example, insurance person enter into the hospital, you getting any benefits? Definitely. What is that? So no need to pay the consultation fees, no need to pay the investigation fees, no need to pay the what is that surgeries, bills and everything. What is my question is how to claims to the doctor? What are the source of income doctor is? Okay, clear? So here the insurance company pay to the doctor. The insurance company pay to the doctor in a way. What is the ways? The insurance company give the instruction to the doctors. If you want the money for your treatment, you just record a voice record, then we are paid and chepestam. Okay. Here the doctor, what do you do? Whatever the work upon the patient, whatever the managed on the patient, whatever the treatment on the patient, everything record a voice record. The voice record converted into text format by the medical transcriptionist. The text format converted into universal numerical coding system by medical coders. From the universal numerical coding system, the billers give the billing, and these billing claims to the doctor through the insurance company. Here, what is our duty? So, text message converted into universal numerical coding system, that is our job. Here, text message nothing but what is that? Prescription. What we are converting? Managed diseases and managed injuries, and we are converted into universal numerical coding system, that is our job. Here, for example, the patient suffering from fever. Okay, the physician prescribed ciprofloxacin and paracetamol. Then we are converted into R50.9. That's it. This is our job finish. Okay, for example, the patient suffering from hypertension, the patient prescribed atravastine and amlodipine, we are converted into I-10. That's it. This is our job finish. For example, the patient documented chest pain, no management. Here there is no management. We are not assigned the code number. Why? Because there is no management. Here, what is our duty? Thoroughly observe the case sheet, identify the managed diseases and managed injuries, and we are converted into universal numerical coding system. That is our job. Let's we go with what is the syllabus of medical coding. First, we cover the anatomy and physiology and pathology and medical terminology apart from our body level systems. After that, ICD 10 cm and CPT 4 and HCPCS. This is entire our medical coding syllabus, and we cover the syllabus within the 45 days to 2 months. Include the fees, we are providing LOM book and ICD book and CPT book free. There is no extra cost for that. So let's we go with what are the salary structure of the medical coding is. In our Hyderabad, there are total 25 plus companies are there. These 25 plus companies are divided into two types. 10 plus companies are MNC and 15 plus companies are non-MNC companies. In the non-MNC companies, they're paying 0 months. 0 months means you are joining none. They're paying minimum 10,000 to 11,000 rupees. Up to 6 months. Why? Because after 6 months you are under provisional period. After the 6 months, they're paying 30% hike. At least they pay minimum 12,000 to 13,000 rupees. Up to 1 year. End of the 1 year, again 30% hike. At least your salary will be 15,000 to 17,000 rupees. From 1 year to each and every year, 30 to 40% hike based on your accuracy. Coming to the MNC company, they're paying 18,000 to 21,000 rupees salary. And all MNC companies, they're providing the cab and food facilities to you. Okay, and MNC and the non-MNC companies, daily 8 hours and weekly 5 days. That means Saturday, Sunday fixed off. By joining our institution, we are providing 100% job assistance to you. Why? Because my students are placed in each and every company in the Hyderabad, in the Chennai, Vijayawada, Bangalore and the Pune. Okay viewers, we are providing 100% job assistance to you, and join with us and get success.